I think in continuation with the series on allergy legends conversation, today we have an eminent person in the field of allergy and respiratory medicine, Dr. Mahesh PA from JSS Medical College, Mysore, Karnataka. Sir doesn't need much introduction. Sir is one of the renowned names in the field of allergy with many epidemiological studies to Sir's credit. Sir has collaborated with various projects with ICMR, the Department of Science and Technology, and also international collaborations with University of Chicago, the National Jewish Health, and Imperial College London. And I think his studies have been more quoted for the epidemiological studies in the field of allergy and respiratory medicine in India. And Sir is also one of the top researchers from India, as highlighted by the universities from the West. Sir, thank you so much for joining us for this conversation. To start with, sir, can you tell us briefly how would you describe yourself? Not as a doctor, but we all hear you from the scientific perspective and during lectures. But how would you describe yourself, not just as a doctor, but as a person, sir?
I think, professionally, other than a doctor, I can lay some claim to be a researcher and some claim to be a teacher. My experience with being a teacher did not start out very well. As PGs, we had to teach our students and UG students. So I studied for a week, prepared, read all the PG textbooks, gave them a 1 hour talk. And fortunately for me, I had to keep the attendance and then move back to my ward. So I could hear the students speak. So as I crossed the closed door, I heard a student talking, "How was the class?" The other student said, "He spoke very fluently, but I didn't understand anything." So that was how my first experience as a teacher started. Then I observed my teachers, who were among the very best in the country, how they taught, how you need to understand what is the level of the person you are trying to teach and how you can reach them in a way that they will understand. So the journey has been good over the last 3 decades. And similarly, as a researcher, I was exposed to some of the best in the country who are all visiting professors to McMaster and Yale University in US. And my exposure in Toronto Medical College has led to me to be what I am today. Personally, I was a very angry kid, but I think I joined Sri Ramakrishna Vidyashala in Mysore. I don't know what is about that institute, but whoever I have seen who have gone there are generally very calm. So I became a very calm adult and maybe a teenager also. From the day I joined Vidyashala, that is something I can very well remember. Over the period of time, I have learned to accept whatever comes my way. I don't complain too much. And as a person, I said, yes, this is what it is. And I've learned to accept whatever comes my way. Some things are good, some things are bad. But you try to maintain an equipoise and accept both. That I can say about me as a person.
I can't imagine you being an angry young kid, sir. You're so calm and poised all the time I interact with you. So I think it's a little hard to for me to imagine that. But I think, as you rightly said, the transition happens, and that's how the journey goes. I think that's for me also to learn from you how to be more calm. Sir, sir, when you came into respiratory medicine, I know you have done a lot of work, but what specifically drew also you to the field of allergy and pediatrics in specific, sir? And what keeps you passionate even today? I think because you keep on publishing, and each time we have to look up for any reference, your article comes to our rescue.
Thank you. So, see, one of the things I realized, we were exposed to pediatrics as students because we used to get a lot of pediatric references. And even now, even in JSS Medical College, we get a lot of references from the pediatrics department as well. And regarding the allergy aspect, I realized very quickly that almost 50% of the adults that I see have airway remodeling, which means whatever I can do now, they will still be symptomatic. Their lung function can never return normal. And these things can happen quite quickly in some patients. Therefore, I realized my research has to have significant pediatric component. So, if you see, a lot of my research work goes into pediatrics. Even now, I have a 10 crore project looking at children 11 to 14 years of age and following them up for about 4 years to look at the impact of air pollution, physical activity, diet, nutrition, and their lifestyles. And it's a 10 crore project across 4 cities. We have recruited about 4,141 children who have acceptable spirometry. We have screened nearly 6,000 children. So a lot of my research work now includes children. And one of the main things is once it is irreversible, there is nothing much you can do. Even we chose these children in 11 to 14 because the peak lung function happens at 18. And once it has happened, then there is nothing you can do. So you want to do something, it has to be in the pediatric age. So early life is very critical. And very quickly I learned that, this is where I should concentrate on because once it has happened, there is nothing much to be done. So short of lung transplantation, it cannot be reversed. So I think the children is where I started concentrating. Also, again, in our own studies, we have found nearly 50%. It is not a small number, 1 in 2 asthmatics over a period of time become irreversible. So you need to catch them early, and that's one important thing. Second issue, again, in our own studies, we realized people move from allergic rhinitis to asthma very quickly. Almost 80% do so, especially in children. They do so within 2 years after their first symptoms of allergic rhinitis appears. This is a paper we published in 2009. So again, if you want to prevent asthma, which is one of my major focus of practice and research, you have to catch them early. So I see the first child with asthma, the second child, the mother brings the second child when the child has the signal rhinitis. So we are able to actually work on preventing asthma in the second child. So I think these are two. I mean, there are others, but these are two main factors that made me think I have to, sort of concentrate. Almost 30% of my current practice, I see children, and this is where you can make or you can give the maximum benefit to prevent a lot of morbidity and even mortality, later on in a person's life.
I think it's a bonus for us to have you contribute more to research in pediatric allergy because that's the main lacuna we find. Um, Sir, you are a mentor for most of us, sir, and we learn from you day in and day out. But we would like to know, was there any particular mentor early on in your life or a moment who influenced your choice to come into this particular field, sir?
I was, fortunate to get a seat in Toronto Medical College, and there Professor Ravindran in the 1960s. The main center where allergy grew in India was from VP Chest Institute, Vallabhai Patel Chest Institute in Delhi. That was Shivpuri was the one who recognized allergy in the days when nobody talked about allergy in India. Everybody thought there is no allergy in India. So he was one who started. And my teacher, Professor Ravindran, trained under him and realized the value in his practice and set up allergies. And we had a separate allergy clinic. It was the only one in South India. It was a government institute, and it is to cater to 3 states. You can imagine the waiting period. If somebody comes and our teachers say, okay, you need an allergy test, they have to go to the office and give a card. You used to get the small cards. We don't find them these days, but we had those small cards. And they have to write their address and give it to the office. And they would be called for allergy testing after 2 years. So we ran an allergy clinic about 4 days in a week. We had 2 units, and drug allergy was about 10 per day. Inhalant food allergies, we were about again another 10, 12 per day. So with that load, I realized that this is something that is very important. I was not very happy with other, critical care or lung cancers, uh, where, people really die. A lot of people die at the end of it. I went to KM Bombay to look at critical care and realized that after 2 months, there was only one person who walked out of the ICU. Everybody died. If not today, 2 weeks later. So my interest, I wanted to really, make sure I'm in a specialty where I can help people. And Professor Ravindran came and set up the entire, in a government medical college, you had aerobiology, you had the manufacture of the allergens in the government medical college. He has
Oh,
set up
okay.
everything end to end and clinical practice. So end to end, he had set up entire in the government medical college. So with 2 year waiting list, I said, yeah, this is the specialty, and I realized that hardly anybody was doing it in Karnataka, and it would be very good for me to start, my focus in this field. So I can say Professor Ravindran, who was the pioneer in South India and had set up the entire spectrum of allergy, starting from collection of the pollens to the aerobiology to the different places, the hills, plains, coast, what are the different, kind of pollens that are relevant, and set up the entire thing in the government medical college. So I think, and we used to visit, where these things were collected. We used to see what they did. We used to see what the lab did, then the aerobiologists did. And I think this had a major influence on me to choose this particular.
Thank you, sir. I think I was not really aware of this piece of history, sir. So I think it's quite interesting to know. Sir, when you came to Mysore, I think it was not easier for you also to set up beginning from the scratch again. And with the limited training opportunities or the limited opportunities at this time, how did you navigate back then? I think it was quite difficult for people to accept also, sir.
Yeah. For in 19, when I came in 1997 and I started the practice in Mysore, hardly anybody knew that there is a field called allergy. And nobody practiced allergy. Maybe there was just one or two in Bangalore. Otherwise, the entire Karnataka, there were hardly anybody doing it. But I think once we started, we spent a lot of time educating patients. I remember, because the practice was also not very busy, we had enough time, and we spent about 2 hours for every patient. We know that these people will refer to other people once they have a good benefit. So we spent about 2 hours explaining about the disease, the treatment, the allergy avoidance, the need for it, allergen threshold, uh, then the allergen immunotherapy, why it should be done. So I think with that 2 hours then had a lot of impact, and those people were our ambassadors to spread the message in the field of allergy in this part of the state. The training, we had no issue because 3 years I was fully immersed into the allergy field in Trivandrum Medical College.
Sure, sir. Sir, your journey has been quite inspirational. But if you would want to choose any one or two parts, I mean, those which has really, I mean, which you want to relive again, or which is very nostalgic for you, would you mind sharing your thoughts on the same, sir?
I think that about 4 years we spent in the Europe Rival project. I was a little early in my career, and that was a time when twice a week we used to have meetings in Europe, and some of the best minds in the field of allergy in Europe used to come. I learned a lot, how to write papers. They used to sit for 3 4 hours and finish off a paper right there. Everything would be written, including references. Everyone was so knowledgeable. They knew all the references by hand. I learned a lot from it, and I wish I could have learned more. Now I realize that if I had such an opportunity, for example, now I would have learned much more, or even if I knew what to learn from those people, maybe I would have learned much more. So those 4 years in which every year we had two visits to, I visited a lot of countries, almost 8 countries in Europe for these meetings. And I mean, I could have sort of utilized it to learn much, much more than what I did. Of course, I did learn a lot, but I think now that if I could have learned more. So if there's some part, one section of my life where I would like to revisit, that's one.
I think recently in the last few months, when I'm a part of project with Dr. Gary, I think he speaks very highly of you, and he's so much aware of the South Indian cuisine and what are the common foods. And I think it is the your working relationship with him. I think he's so knowledgeable about it, and he speaks very highly of you, sir.
Oh, thank you.
Sir,
Gary was our team leader. We had 3 centers, and Gary was the team leader for 3 centers. We had India as tropical, Hong Kong as subtropical, and Siberia as subarctic. And Gary was our team leader.
okay. So he says if you have any issues, you just refer to Dr. Mahesh and he will help you. So that's a kind of respect he has for you, sir.
That's good to know.
Sir, I mean, were there any other, early challenges when you were advocating for allergy care? I know, I think there must have been a lot of resistance when people, as you rightly pointed in the earlier conversation, that awareness was less. People were talking about allergy prevalence not being in India. I think, what were the early challenges you faced, sir, while propagating allergy education and care?
Yeah, once I started in 1997, I came here. Actually, Professor Ravindran told me if you want to settle in Kerala, he'll find me a job. He's like a second father to every one of his students. I don't think we can match him. I said, no, sir, I want to go back to my place. He said, okay, I may not be able to help you then. Anywhere in Kerala, I can make sure that you can be settled. So I came to Mysore. I started off with my allergy practice. That is when I met Dr. Vedantan, and he was interested to start an allergy center in Mysore. That is his hometown. I actually still run the clinic in his house. And as soon as he heard that I trained under Professor Ravindran, he said, when do you want to start working? I said, from tomorrow. That's how we started. And the first year, of course, we had to really struggle because nobody understood what is allergy. In my medical college, I had a very senior person from social and preventive medicine. When he heard that I'm setting up an allergy practice, he said, are you mad? You won't get any patients. You do general practice. I said, no, sir, it's okay. Even though I get very little, I know it's an important field because Kerala, I knew, drained Kerala, Tamil Nadu, and Karnataka in the waiting list for 2 years. I didn't tell him that. I said, this is what I like, sir. This is what I would like to do. It's okay. If it is slow, it is slow. I will see less number of patients. And when we talked to the patients, nobody understood allergy. Nobody understood inhaled medicines. So, as I said, we spent about 2 years educating everyone, and I think they have been excellent, brand ambassadors for us. And slowly, from second and third year onwards, it took off because some of the very senior people, my local mentors here, uh, one was a dermatologist, Dr. Kushalappa, and another was a physician, Dr. Shekhar. And I believe they were my local, I call them godfathers. And they referred the cases with allergy because they realized that, yes, what he is doing is of value that can help their patients. And from then onwards, we never looked back. So initially, yes, first 1 to 2 years, we had a lot of challenges because, including the doctors, nobody understood what is this allergy.
Sure, sir. I think that is what drives you more to give the best for the patient. And sir, was there any particular patient you remember or any particular instance where you thought this was worthwhile, the effort to put up the allergy practice and which motivated you to do more for the clinical practice of allergy?
Yeah, very early in my practice, I was asked to see a child, 9 years old, and was suffering for about 4 years. And the disease was very rapidly progressive. By the time I saw him, 9 years old, he needed about between 20 to 30 milligram of Visalon every day just to survive. Even with that, he never slept. Last about 1.5 years, his mother said he never slept. His mother also never slept. And that is when I saw the child. I did everything. I could do treatment. I was not able to reduce Visalon to less than 20, nor I could make the child sleep. And at that time, it was around 99. When Vedantan was here in Mysore, he saw the child. He said, "There's nothing much. I don't know what to do." He took the entire case history of a couple of months to US and talked to the best minds at National Jewish, and they said again, there is nothing extra for us to add. We thought it could not be asthma. We did everything, ABPA workup, bronchoscopies, foreign body, CT scans, everything. It was only allergies. After about 3 months of everything I tried and still not able to reduce it, reduce voice load to less than 20 or make the child sleep for a single night. Then the mother asked me, "Is there anything else in your field that you have not tried on my child?" I said, "I do allergen immunotherapy." That was, we used to do injections at that time. Slit was not there. And she said, "Okay, why don't you give it to my child?" I said, "It's a contraindication according to textbook. Your child has not only severe asthma, I don't think they have a definition because he cannot even blow anything in a peak flow meter. And I don't think they have coined the severity uh, of asthma for your child. And maybe life-threatening asthma fits it, and that's an absolute contraindication." He said, "If there is nothing else, looking at the progress, and you have seen over 3 months, he is still progress further. I don't think he will survive the next year." So if you say it's contraindicated, but there is a treatment, and can it work? I said, "I have no idea whether it can work or not." She said, "There is nothing else. Anybody, you have sent details to US, you have done everything, there is nothing else. And I am very sure, looking at the last 4 years of his life, that he is not going to survive the next year. If he is going to die early, I am willing to accept it. My child is yours. You go ahead and treat. Use this." I said, "Let me take some time or 1 week." I didn't want to give an injection and cause the death of the child. It was very, very difficult, but I took a week. And then I said, "Okay, the mother has said there's nothing much to be done and she is willing to accept. Okay, let us do it." So with very, very, in a lot of hesitancy, we started with the highest dilution. I called my teacher's son was running the uh, Allergen manufacturing unit in Trivandrum. His first son was my junior. His second son went into aerobiology and he had a lab. I talked to him. I said, "Please give me a highest dilution possible." And slowly we started from that. I was wondering when he would drop down after an injection, but he went on. But 3, 4 times a week, he still needed nebulizer. He used to come in the evening. He still needed 30 milligram. We tried to reduce it to 20. He used to have a breakthrough. Uh, I thought after about, when I was nearing 2 years, I thought this is not working because he still needs nebulizer 4 times a week. He still needs 20 to 30 milligram of Isolone a week. What I didn't realize at that time, about 99, is that he is still surviving, that his disease did not progress. Uh, I didn't realize that. Now I realize that now. And when about nearing 2 years, suddenly I didn't see him for 3 weeks. At that time, he had reached an injection for about once in 3 weeks. And 3, 4 times a week, he used to come for nebulizer. Suddenly, I didn't see him for 3 weeks. I was too afraid to call his house and find out that he is no more. So I kept quiet, and suddenly after 3 weeks, he's there for the injection. I said, "What happened?" He said, "I'm fine." I said, "Okay, now this is something." And he continued the injections for, even though we started slit, he continued later on about 2000, he continued skit. He completed about 7 years, and he was shorter than his sister. His sister was about 2, 3 years younger than him, and he was stunted. He was shorter than his sister. By the time he finished 7 years of immunotherapy, he is now, I saw him later in his teenage years. He is now a 6 footer. By about third or fourth year, he caught up the growth and he became taller than his sister. And after 7 years of immunotherapy, he is not taking any medicines. I saw him pre-COVID. He had come with another patient. He said for the last decade or more, he's not used inhaler even once. And I think that made my day, or my year, or my decade, you can say.
Very inspirational, sir. This is to re-emphasize the belief in immunotherapy, where a patient who was so much dependent on pharmacotherapy and nothing more could be done, and he's leading a normal life without any medications. I think that's the best you could. And I think this will also stay with me, sir. I think we should not
Yeah.
stop working for our patients. Thank you. Thank you for sharing this, sir. Quite inspirational.
And even then, I think one important point for all pediatric allergies. See, I think there was a Lancet paper that said inhaled medications cause stunted growth. I have a series of about 7 children now, including this boy I told you about, who all had stunted growth. But once with immunotherapy, their disease was controlled. All their growth, they caught up. If you do that before the age of 18, they will be able to catch up their growth also. So I believe the stunted growth is due to disease, because in which children you will use more dose of inhaled steroids? In those with more severe disease, simple common sense. So even a Lancet paper, sometimes they really don't look at the patients very carefully, I think, and they say it is related to the drug. I strongly believe it is related to the disease, because in my own series of patients, these 7 children needed oral steroids every day and they were stunted. But once their disease is under control, they caught up the growth. And suddenly, next 2 years, as soon as disease is controlled, the next 1.5 years, after high dose inhaled steroids, reducing tapering dose of oral steroids, and immunotherapy, in the next 2 years, all of them caught up their growth. None of them had stunting. So I strongly believe that Lancet paper is wrong. It is due to the disease that causes stunting and not the pharmacotherapy. Because of this, what happens? The pediatricians are afraid to use higher dose of inhaled steroids.
Yes, sir.
And children will remain stunted. So don't hesitate
Yes,
to
sir.
use the dose necessary.
Yes, sir. I think that's a very important message because, as you rightly pointed, sir, even today, I think using inhaled steroids at a little moderate to high dose is a little stigmatic. And even the resistance to start immunotherapy in pediatric age group also is, we find that hindrance. I think this is a very good message for all of us, sir. Sir, you have noticed the evolution of allergy in both adults and pediatrics in our country, and you have been at the forefront. Sir, how has the public and professional awareness of allergic diseases changed over the last decades, sir?
I think since 1990, it has been very, very low initially. Now, a lot of patients I see, because 95% of the patients I see are referred from old patients. So the time I need to spend now to tell people that they need inhaled medications, that they need immunotherapy, from 2 hours, it is now reduced to 30 minutes. They don't have as many questions because they have seen it work in the other people who have referred them to me. So I think the public awareness, at least in my part of the state, is very high, at least in the people that I see. Professional awareness, yes, there is suspect grudging recognition now that allergy is a specialty in itself. I think it is there now.
Sure, sir. Thank you. Sir, have you noticed any changes, what you have seen during the diagnosis, immunotherapy or preventive care in the last 2 to 3 decades, sir, of your practice?
When we started off in Trivandrum, we did a lot of intradermal. There was no skin prick test. But I think after a decade later, skin prick test was given importance. And now almost everybody is clear that skin prick test is the gold standard. More and more people in the last, I think, few years are even doing CRD. I believe it's a very useful tool, but I believe we have not understood it quite well yet, at least in Indian population, where the total IG is very, very high. How to interpret this? When a serum specific IG itself is difficult to interpret, interpreting CRD is a nightmare unless you have what is there in the normal people. I have not seen any CRD study in normal population in India. And unfortunately, with Europreval, I took about 2 years to get government permission to send the blood outside. Otherwise, we would have CRD data in normal population in India. Because we were not able to send, their CRD kits expired, and we did not, unfortunately, because without having data from normal people, I don't think we are in a position to interpret CRD well. But it is a useful tool. The next decade or so, I think more and more data about that will come. I see people now realizing that to prevent asthma, you have to treat rhinitis. My patients are very clear. After the education we give them, the next person in the family comes with rhinitis. So they are very clear. But it is a message that I would like to see spread more and more in the community. And more, especially allergists in India, take that up also as something that is equally important to manage their patients.
I think you have shed the light on CRD, sir. I think component testing, though it is available, I think misuse is also more common. And as you rightly said, we should always try to use it justifically. Sir, what has probably given you an element of surprise when you think the allergy care is evolving in India? Can we do better? Or are we doing justification for our patients the way we treat them? I know there is always a scope for improvement, but I think we would like to take few words of wisdom from you how the allergy care can be more optimized for the patient care.
I think, see, every patient in whom you suspect allergic disease has to undergo an allergy test. Whether they go for immunotherapy or not, it is important. Now, for people to understand that and refer patients to an allergist, the doctors should be aware. For that, all medical colleges must have an allergy department. Then only people will become aware. Otherwise, it is very difficult if everybody passes out without even understanding what is an allergy. They read about 3 pages in their MBBS. And I don't think we can expect them to have a lot of understanding that it's a specialty in itself. And the material they have to read is as big as, say, MD medicine. Unless actually such information is there with the medical professionals, we can't expect them to take the specialty seriously. So every medical college must have an allergy department. I feel that's the biggest problem or gap we have. And once that is done, the specialty will grow much more faster than what it is doing now.
Right, sir. I think the lacuna in our medical college, in the medical curriculum, I think at the medical college or at the NMC level, where I think if it begins with the undergraduate recognition, as you rightly said, sensitization at that point would definitely help us in the long term. Sir, going on to your role as a mentor for all of us, How do you see the role of mentorship in shaping the next generation of allergies, both pediatric and adults in our country, sir?
I'm always happy to mentor anybody who wants to study allergy or do research in allergy. And mentorship is very important. We have to train the next generation of people. And since there are no allergy departments in the medical college, the mentorship program itself is the way to go. And I hope the Indian Academy of Pediatrics and the allergy section within that will have a list of mentors for whoever wants to learn the subject and whoever wants to research in the subject. So, since there is no formal training in any of the medical colleges in India, I think mentorship is the single most important thing that would drive and shape the next generation of the specialists.
Sir, for me, on a personal level, I think you're a very core mentor for me because whenever, since the time I have started practicing allergy in Bangalore, how to set it up, or if I need any papers, you would, I mean, when I reached out to you, you would have been always selfless, even though it was I mean, access through institution or anything, but you have been always selflessly sharing and guiding how any projects or any research or patient care has been there. So my personal level, I'm very grateful for you for your mentorship, sir.
Thank you.
Sir, what are the core skills of or the mindset should anybody who's starting their allergy practice, the pediatricians, should have in mind if they want to go a long way in the field of allergy, sir?
See, I would share from my own learnings that though I do respiratory medicine in my medical college, 9 to 4 is respiratory medicine. In my clinic, it is only allergy. It's a small bit of 10% patients with COPD. Other than that, 90% of the cases I see is allergy. And this dedicated time every day, if somebody wants to develop the real depth and skill in the field of allergy, they have to give at least 4 hours, if not 5, every day, dedicated to only the allergy. Now that is when you start realizing, and again, our training, I realized a lot of what I did in my early phase of the career was wrong. And it took me about 15 years to really get a handle of it. 4 to 5 hours, 6 days a week, uh, 15 years to actually get some handle over the subject because we did not have very formal training programs. And as I said, we used to do intradermal when we were PGs. So when people simply say clinical correlation, all textbooks say, but they don't explain what it is. And actually, to understand what is that clinical correlation, how to apply it to clinical practice, and do it well, my again understanding improved step by step. And it took me about 15 years really to get a good handle of what this simple term clinical correlation means. So unless somebody gives a dedicated time, they will not get the depth at all.
Yes, agree. I think it is the passion you have to take out of your personal time for the subject and try to go more dwell into the subject and learn about it on a personal level. Sir, in continuation with our conversation, we were talking about the lack of formal allergy training programs in our medical college curriculum. But I think probably in the near future, the time may be ripe for us to see the allergy training program. If I mean, if you were to design an ideal allergy training program, what all the elements you would want to see in that program, sir?
Okay, an ideal allergy program would be minimum 3 years, and ideally it would be in a medical college. You have a core set of teachers to practice allergy full time, and then you have the postings also in ENT. You have postings in both adult and pediatrics. You would have skin people coming in. You would have postings in microbiology to actually look at all the various immunological aspects and the lab. So I think, and you would have a section on the botany and the aerobiology. I think if these factors were to come in and they spend at least 4 months in ENT, 4 months in dermatology, 4 months actually looking at the aerobiology, botany. So in a 3-year course, a full-fledged MD course, you have a core allergy department with supplementation from all the rest of the ancillary departments. I think that would be the ideal training program.
Sir, going forward in the road ahead, say probably in this next decade, what's your dream scenario for the change in allergy care in our country, sir?
I think one that is most important is for to have locally available standardized allergens for all the most important allergens in India. So that I think is the dream scenario because now after the training started in CMC Vellore, the first 3 years of the program, all my 1 month early with the medical college, I used to be in CMC Vellore teaching. So I think that has put out a lot of good trained people. But the major problem I see with this, now there are other programs also. The major problem I see these people don't have good allergens to practice. So that I hope by 2030 we will have standardized allergens for maybe top 10 allergens in India. That will be a dream scenario. Because if these people don't have good tools to practice, the next generation will be hesitant. So I
Correct.
think that's the dream scenario I'm looking for.
Sir, in the role of education, how do you think organizations like Indian Academy of Pediatrics or NAMS or other medical institutions who are robust academically can contribute in the near future for this, sir?
I think these people can highlight the role and relevance of the field of allergy and force the government to make allergy department in medical colleges mandatory because allergy is such a common disease.
Yes.
Unless that is done, because like for example, if you take pulmonary medicine, because TB was a dominant disease in India, which the government wanted to control, they said no UG training without a pulmonology department. This was made mandatory. So once it's made mandatory, everybody will fall in line, and all the medical colleges will have the kind of allergy department, and maybe have an MD in allergy. Once they do, and this is the curriculum, they should allow the people training other specialties, but those who are practicing allergy to be a part-time faculty and run the department. Now, VPHS Institute runs MD pulmonary medicine, DM pulmonary medicine, and they are right there in Delhi, and but they are not able to even though diploma in allergy is approved by the NMC, but they are not able to run because they want dedicated faculty. They run a very strong allergy department. But they are not able to start diploma because they have to remove faculty from pulmonary medicine, then their number of seats will go down. The government doesn't allow them to take new faculty only for the field of allergy. So even in VP Chest, in the top center in the country, they are unable to run a diploma in allergy. Because if they remove faculty from the pulmonary medicine, the number of seats there will come down. And the government is not getting them to recruit new faculty for only allergy.
Yes.
So that's why the government will have to. And if the MD starts in VPHS Institute, it will start in a lot of other places.
I think the pressure has to come from the top academicians of the country as well. Sir,
Yes, yes.
sir, are there any global trends or innovations which you think India should embrace more quickly into the clinical practice of allergy, sir?
As I said, once we have an important set of standardized allergens, even if you do 10 allergens, you pick up more than 80% of the cases with allergy. That's all you need. I think that's the most important. Then, of course, it's more research. How people behave in India is quite different from how people behave in the Western world. So I do believe that a lot of innovations and research has to happen in India. And even if you look at the severity of the allergy, I was part of a difficult asthma teaching slide set for the American Academy, where I had a chance to speak with people 30 years my senior, like Professor Goldstein. And they said they are at the very peak of the kind of referral for the allergy cases. And they see 1 in 2 children, they has difficult asthma. They struggle to control even with biologics. So Indians, fortunately, it is less than 1% cases where we actually struggle to control the disease, and patients still say you put everything to them and they still say I am still coughing, I still have sputum, I still have wheezing. So that's a small number in India. And why it is so? But that severity I see is increasing. For example, when I started my practice in 1997, 200 microgram of budesonide twice a day would control the most severe aspect. I've not used, I keep all my files. My teacher said data is power. So from the first patient, every visit till we are reaching about nearing 30,000 now, we have a file for everyone. So if I see the prescriptions I did, we hardly gave any medicines and people were doing extremely well. Now, even with 10 medications, they still say, I'm not happy. So we need to understand why the severity of asthma and allergies are increasing over time, what we are losing that was protecting us before. And the same thing with food allergy. We have the lowest prevalence of food allergy. The Indian government called for a meeting on food allergy. As soon as I finished my study on Europreval, 2 years later, they did call. And in the meeting, I presented my data. Very senior ICMR member said, okay, then there is no need to study food allergy. I said, sir, you need to actually study why we are protected and not wait until the disease blows over, because it takes 2 doctors, 2 days to do an oral food challenge to confirm for one food. Where you will find such number of doctors in India? Absolutely never. With the population we have, it's okay in the Western world. In Spain, when I went for training for this Europreval, this is what I saw: 2 doctors, 2 days for one food to do a double-blind placebo-controlled food challenge to confirm. It's a nightmare because the children have very severe reactions. The doctor always had to be at the bedside. They can't take any other responsibility. So why we are protected? Both for food allergy, why we are protected? We don't have as much severe asthma as we see in the Western world. Those are very, very important reasons we need to find out. And the main innovation I would hope somebody will do is to find out why we are protected and make sure we stay here where we are, at least where we are today, if not where we were 30 years ago.
Very right points, sir, highlighted. And I think in the same line, I think it was a moment of pride for me when I was in the recent American Academy Congress during a plenary talk on the impact of air pollution. A slide was dedicated to you and your team, and they displayed it. So it was a moment of pride for me as an Indian, sitting there amongst so many other nationalities where we do not get much recognition, but I think people like you and your team give us that moment of pride for us to be there, sir. So thank you for that, sir.
Thank you.
Sir, in the next few questions, we have sounded it rapid fire. Sir, a myth about allergies you would like to bust, sir?
Milk causes phlegm. I think in children, at least in the Indian diet, milk is a very dominant source of protein. And you remove milk from the diet, the child gets malnourished. So milk causes phlegm, I would like to bust.
Yes. Yeah, I think very relevant, sir. One allergy tool or test you absolutely trust and do it in your practice, sir.
Skin prick test.
Sure. Your favorite scientific journal or to-go resource for any reference?
That would be the JACI. That's a Quad AI journal. And that's the standard. JACI in practice, JACI global. They maintain this standard.
Yes. One clinical pearl that you wish every pediatrician knows about, sir.
As the disease progresses, it tends to get worse. It needs more and more medicines. Therefore, treat allergies early and aggressive.
Sir, one allergist in India or globally whom you have a lot of admiration, sir.
I think in India it is Dr. Rajkumar, almost from BB Chess Institute. He is now the director. Almost all the oral challenges, double-blind, placebo-controlled food challenges in India has come from him. Almost all. Internationally, there are quite a few. Dr. Vedantan would be there on the top of the list. The other people I have worked with in Europe, Dr. Maria, Dr. Peter Burney, Dr. Gary, and Andy, with whom we did the first project in the US to look at the endotoxins in asthma. So quite a few in the Western world, and Dr. Rajkumar from India.
Thank you, sir, for sharing that. Sir, a book, a quote, or a philosophy that guides your day-to-day practice, sir.
Entire, what I believe in life is what Gita says: work is in your hand, but the result is not. So I only concentrate on the work that I have to do, and I accept the result I get without much complaining. I think that is the main, I believe, saramsha, if you can say, of the Gita. That's one of the key things. That I follow very dearly. The other thing I'm still trying to learn to apply in my life fully is what my father said when I was a very tense student preparing for the exam. He said, you should lead your life like with watchful neglect. Watchful neglect. That he said that's how you lead your life. Exam is just one part of the stress you will face in your entire life. And every time you have a situation, learn to live that with watchful neglect. I'm still learning to live it 100%, but good amount I think I've been able to achieve. It's a very difficult thing to do. It's a very simple word, but both are opposite to one another. Watchful neglect. I think he has been able to live like that. I reached a fair bit, but let us see.
That's a good message for all of us, sir. Sir, if you weren't to be a doctor and leading allergies and the respiratory physician, what would have you probably been, sir?
Either a researcher or a teacher. I think even when I was very young, I was fascinated by research. When I was in, I think, third standard, I was given a big green book, that has an empty page on one side and a lined page on the other. And what I did with that book was collect all the people who got Nobel Prizes in science, whether physics, chemistry, or medicine. And I used to wait for the year when it would be announced to collect all the photographs. And in the line page, I would write in my own words of what they did and why they got the Nobel Prize. I did it till 7th standard until I went to Ramakrishna Vidyashala. So I think I would have been a researcher.
Thankfully, I think you are still contributing to all your chosen fields, sir. Being a teacher, a mentor, a clinician, and a researcher.
That I learned from Professor Ravindran. He said for a doctor to reach the pinnacle, you need 4 sections. One, he said you need to know your theory well, otherwise you won't understand your patient. Second, he said you need to know how to deal with patients. Your theory is different. Some of the best gold medalists do not have good practices. So you need to know how to interact with patients, how to do the practical aspects of it. Third, he said, if you can then be a teacher. Teaching is a separate skill set. You have to really work hard for it. And I learned a lot from him. And fourth, he said, you do research and add something new to the field. He said, you do all these 4 pillars and then you will reach the top of your field. That's what I learned from him.
And that's what we will also try to carry it forward, sir. Sir, thank you so much for sharing your wisdom and journey. I think it has been a very good time for me to interact with you on a personal level. And I think it's very difficult to get your time in all your schedule. But thank you so much for taking time from your schedule for talking to us. So before we conclude this program, any message for young pediatricians or allergists, and or you have a wish for seeing the future of allergy care in our country, sir?
The main message I'd like to share is what I've shared earlier. One is give dedicated time for allergy practice. Second, I would say collaborate with others. See, I'm a clinician. I cannot do lab work. I'm not trained for it. So I work with a lot of people who do basic science. And that has helped me tremendously to join together to come up with fantastic papers. We worked only on brinjal allergy, 5 PhD students, 20 years until he retired in CFTRI. We had a US retired scientist, YP Ventesh. And we did work only on brinjal allergy for 20 years. But we still don't fully understand it. But that's the way it is. We worked only on the genetic field. We worked with the Mysore Department of Genetics in Mysore University. Again, for 20 years until he retired, we worked on asthma genetics. So I think we need to work with basic scientists. Once you collaborate with your clinical insights and their basic science skills, you can come up with a lot of kind of innovations for the Indian population. And I do believe research is really needed in India, and even clinicians also should collaborate among themselves. Instead of presenting data on 100 patients, present data from 10 centers for 1,000 patients, then I think you will be recognized globally that this study from different parts, different environment, different, that's how the food allergy came about. And 3 new centers came up with which were very different from the kind of food habits, climate, environment in Europe. So only when they compared their data to the data from Siberia, Hong Kong, and India, that's when they were really surprised. So I think research is needed in India, long way to go. Start small and scale up. Collaborate with others, with both clinicians as well as the basic scientists.
Sure, sir. Thank you so much. It was a real pleasure having you, sir. So thank you so much for joining us, sir.
Yeah, thank you. Thank you.
Sir, thank you, sir. Again, on a very personal note for taking time out and having this conversation, sir. Always look forward to your guidance, sir.
Yeah, absolutely. Absolutely.
Thank you, sir. Thank you.
Okay, bye-bye.
Good day, sir. Good day, sir.